Good afternoon. Today we are discussing chapter Temperomandibular Joint. The temporomandibular joint. This is the jaw. The temporomandibular joint is unique and both structures and the function. The multiple bones they margin from the structures and contributed to the functions of the temporomandibular joint. This bone, including the mandible, maxilla, temporal, zygomatic, and sphenoid and the hyoid bones. These bones including by the mandible, maxilla and temporal and zygomatic, sphenoid and hyoid bones. The proximal are the stage segment of the temporomandibular is temporal bone. The mandible they have the function mandibular condyle. This mandibular condyle only attached with the forming the temporal touch the temporomandibular joint. The mandibular condyle and presence with the mandibular notch and the condyle processes. The mandible. The lateral view of the temporomandibular joint, the mandibular bones, mandible, maxilla and temporal bone, and zygomatic bone, sphenoid bone and hyoid bone. There is showing the lateral view. We are seeing that lateral view of the temporomandibular and bone composition of the temporomandibular joint. There have the mandibular fossa and the posterior tubercle and articular eminence. The cross section of the lateral view of the temporomandibular joint showing the fibrocartilages covered the load bearing surface of the condyle of mandible and articular eminence. The temporomandibular disc divided into the articulation in the upper joint and the lower joint, each with its own synovial ligament. This anterior and the posterior attachments of the joint capsule to the disc are the showing. This is the synovial joint disc of condyle variety. This joint have the synovial joint and the condylar variety. The articular surface they divided by the upper parts and the inferior surface. The upper part there have articulation of the articular eminence and the anterior part of the mandibular fossa. That is the upper part. The inferior surface that is the head of the mandible. This is connecting the temporomandibular joint. The name is derived from the two bones which is forming by the upper temporal bone and the part of the cranium and the lower jaw bone called as the mandible. This is only called temporomandibular joint. The composition of temporomandibular joint. The temporomandibular composition of that mandibular condyle and articulation surface of the temporal bone. After the presence with the capsules, articular disc, ligament and the lateral pterygoid. This of the composition. The overall temporal bone is mandible combined of the creating two separate connections of the temporal mandibular. The two temporomandibular joints are part of closed chain and must function together. The articular surface and the articulation eminence are the mandibular condyle are covered by the dense and avascular collagen tissues that is connecting the some cartilaginous cells. The fibers near the surface of the articular coverage are aligned in the parallel arrangement of the fasciculate glide of the joint surface. The presence of the fibrocartilage rather than hyaline cartilages is slight length become the fibrocartilaginous can repair and the remodel joints. The type of the fibrocartilages is present with the area that have the with the stand of the repeated of the high level stress. The temporomandibular joint are subject to the repetitive stress of the jaw motion. That's also well as temporal bite force. That force measured by the 597 newtons for women and 847 newtons for the man. This force creating by the temporomandibular joint. The mandible that largest facial bone and the highly mobility. The mandible arch shaped consists of the condyle and each posterior superior portion and each mandibular condyle have the medial and lateral pole and the lateral pole is rarely in the palpable. The accessory joint structure. The incarnation of the temporomandibular joint addresses by the unique articular disc. The inferior temporomandibular joint formed the mandibular condyle and the inferior surface of the disc and functions a simple hinge joint. The superior temporomandibular joint, the larger than the inferior mandibular joint, the formed by the articular remnants. The articular remnants of the temporal bone and the superior surface of the disc. The function is the glided joint. This is the articulation disc. The articular disc, the cross section of the temporomandibular joint showing the articular disc. The thickness of the disc variations from the 2 millimeter anterior to the 1 millimeter in the center of the 3 millimeter posteriorly. The posterior disc presents at medial disc and the anterior disc. The occlusion metal is superior laminae and inferior laminae and temporomandibular capsule. The inferior muscle there have the superior lateral pterygoid muscle and inferior lateral pterygoid muscles. The purpose of the disc is allow the convex surface, the articulation eminence and the mandibular condyle. The remaining the coverages throughout the range of the motion and temporomandibular in all planes. The capsule and ligament. The capsule, the elasticity of the joint capsule or ligaments are determined by the available motion at the temporomandibular joint in the all planes. Capsule. The capsule is the fibrous membrane surrounded by the joint and the interruptions of the articular eminence. It attached to the articular eminence, the articular disc and the neck of the mandibular condyle. The portions of the capsule surface superior to the disc is the quite lax, whereas the portion of the capsule inferior to the disc is the taut. The lack of the capsule strength of the anteriorly pre-disc position, the anterior dislocation of the mandibular condyle. The anterior portion of the disc attached with the joint capsules and the lateral pterygoid and this and attached with the posterior translations. The posterior portion attached with the retrodigital disc tissues superior and inferior laminae. The superior laminae attached the posteriorly at the telecar plates allowed the ant. The translation of during the month of the opening and the repositioning due to the elastic property during the month closed. The inferiorly the laminal limited forward translation. Ligaments. The primary ligament of temporomandibular joint is the temporal ligament, that is the stylomandibular ligament and the spinomandibular ligament. The temporomandibular ligament of the strong ligament composed of the two parts, the outer oblique elements and the inner horizontal element. The primary function of temporomandibular ligament is stabilize and the lateral portion of the capsule. The neither band of the temporomandibular ligament limited forward translations of the condyle or disc, but they do limit the lateral displacement. The outer oblique elements attached with the neck of the condyle and the articulation eminence. The serves as the superior ligament and the limited downwards and the posterior motion of the mandible, as well as the limited rotation of the condyle during the mandibular depression. The inner horizontal component of the ligament is attached to the lateral pole of the condyle and the posterior portion of the disc and the articular remnant. This is fibrous and aligns the horizontally to the resist of the posterior motion of the condyle. The limitation of the posterior transmission of the condyle protector and the retractional disc pad. The synovial, the stylomembranous ligament. The stylomembranous ligament of the weakest of the three ligaments and the condylar thickened are part of the wash. Stylomandibular ligament. The stylomandibular ligament is the weakest of the three ligaments and it's contributed the thickest and part of the partial sheath joint of the synovial process, styloid process of the angle of the mandible. The function of this ligament is limitation of the protraction of the mandible. Spinomandibular ligament. The spinomandibular ligament is distribution of the strong ligament. That is the swing of the hinge. The mandible is the suspended. It serves as the protect of the mandibular and the excessive anterior translations. The spinomandibular ligament they attach the spine of the sphenoid bone and to the mandible surface of the ramus of the mandible. The spinomandibular ligament also has the continuity with the disc of medially. This spinomandibular ligament is severe serves the accessory ligament and is the contributor to the temporomandibular ligament providing the structural support of the temporomandibular joint. Joint of kinematics. The temporomandibular joint that is one of the most frequently used of the mobile joint in the body. It's the enlarged during the mastications after swallowing and the speaking. The most time of the temporomandibular joint movement occurs without resistance of the chewing and the contact between the upper and lower teeth. However, the third class lever, the temporomandibular joint distribution of maintaining the structures and the aspect of the scientific force act on it. The osteokinematic of mandibular including the mandibular depression, elevation, protraction, retraction on the left and right, lateral extrusion. The arthrokinematic of the movement involving the rolling, anterior glide and distraction and lateral glide. Depression, the lateral pectoral mainly, the elevators, the mastoid and temporalis, mandibular, pterygoid and both sides. The protraction, the lateral and medial pterygoid muscle. The retraction, the posterior fibers of the temporalis. Lateral are the side to side movement. Example, tuning chain off to the left side and left lateral pterygoid and the right medial pterygoid. The accompanies the mandibular depression and elevation of the mandibular condyle must roll and glide. During the retraction and the mandibular condyle spin relations to the inferior surface of the disc in the lower part joint. The transmission occurs the upper joint between the disc and the articulation eminence. Depression, the mouth opening. The normal mouth opening is done by the retraction of the lower joint between the disc and the condyle and with a pure anterior rotation of the condyle and the disc gliding of the transmission. The anteriorly and inferiorly in the upper joint between the disc and the articulation eminence. The normal mandibular depression range motion is 40 to 50 millimeter. The mandibular require approximately 18 millimeter of the mandibular depression. The elevation, the mouth closing, the reverse of the depression position posteriorly, the transmission and the posterior rotation. The mandibular elevations is the rever of the mandibular depression. The condyle rotate the posteriorly and the disc in the lower joint, and the condyle disc complete of transmit of the posterior in the upper joint. The mandibular protractions and the retraction. The maximum mandibular protraction, the lower teeth short to the forward and the upper teeth. Mandibular protraction and retraction occurs the upper temporomandibular joint. The condyle disc complex translated in the anterior and inferior direction. The falling down slope of the articular terminus during the protractions and the retraction along the posterior superior path. The protraction is the important of component of necessary and the maximal mandibular depression. Retraction is the important component of the mandibular elevations from the maxillary depression and the mandible. Mandibular lateral executions. The normal lateral deviation of the mandible of the right and the midline. The lower teeth should move and the full width right upper central incision. The lateral extension involving the moving the mandible to the left and to the right. The degree of lateral extension of the considered the normal from the adult to 8 to 11 millimeter muscle. The muscle action of the temporomandibular joint divided into primary and the secondary muscle group. The primary muscle group of the temporomandibular temporal is masted and lateral pterygoid and medial pterygoid. The secondary muscle of the smaller than primary muscle and the content of suprahyoid and inferior hyoid and the digastric, gynohyoid, mylohyoid and stylohyoid. Composition of the suprahyoid group. The coordination of muscle action. The mandibular depression occurs the concentric action of the bilateral digastric muscles. The conjunction of the inferior protraction of the lateral pterygoid muscle. The mandibular elevation results from the collective contributor action of the bilateral masted and temporalis and medial pterygoid muscles. The bilateral superior lateral pterygoid muscle the bilateral superior lateral pterygoid muscles eccentrically control the temporomandibular disc as the mandibular condyle. They are relocated into the mandibular fossa with the mandibular elevations. The most common disorder of the temporomandibular disc displacement. The most common cause of temporomandibular pain is myofascial pain, dysfunction syndrome, primarily involving the muscle of the mastications. The internal triangulament defined as the abnormal relationship between the disc of any other component of temporomandibular disc. The disc displacement as the example of the internal degenerative joint diseases, the otherwise known as the osteoarthritis of the organic degeneration of articulation surface of the temporomandibular joint. Temporomandibular joint pain remains one of the most reliable diagnostic criteria of the temporomandibular arthritis. Thank you.